Hi there, it is almost time for open enrollment, so it's time to start thinking ahead and looking at those plans. In today's video, we'll go over the basics, talk about those metal tiers, those essential benefits, premium tax credits, give you an update on 2026, and most importantly, help you learn how to navigate Healthcare.gov so you can choose the best possible plan for your needs. Stay tuned. First, let's talk about those marketplace basics. Now, I'm going to blast through this information as quickly as possible to get to the real main topic of today's video, which is navigating Healthcare.gov. However, if you're already familiar, make sure to check out the timestamps in the description below, and you can feel free to jump ahead to the chapters that best suit your needs. Now, when we're talking about marketplace plans, we're also referring to ACA plans, also known as the Affordable Care Act, or even sometimes as Obamacare. These terms are all interchangeable. You'll see a lot of terms on Healthcare.gov, and it may be confusing. So first and foremost, let's discuss your monthly premium. This is the amount that you have to pay out of pocket to keep your insurance active. You'll also notice the term premium tax credits or premium subsidies. This has been a hot topic in the news lately. Premium tax credits are basically just a tax credit paid up front, which is reflected in a largely discounted monthly premium. If you're eligible for a premium tax credit, you'll see that reflected in your monthly premium when you're previewing the plans. The next term you need to understand is the deductible. This is the amount that you have to pay out of pocket before your insurance begins to contribute to the cost share. Now, many services will be covered even prior to meeting the deductible, especially those preventative services that are covered under the 10 essential benefits. More on that in just a minute. Another figure that you need to know is out-of-pocket maximum. This is the maximum that you'll have to pay out of pocket for any covered in-network services for the calendar year. If you reach your out-of-pocket maximum, your insurance carrier will take on the remainder of the bills for those covered in-network services for the rest of the calendar year. You'll also see that the plans will indicate whether they are HMOs, EPOs, or PPOs. In all honesty, PPOs are not very common on the marketplace. Basically, these plans will offer you varying levels of flexibility at varying price points. Generally speaking, HMOs will be the least expensive plans, however the most restrictive. You must stay in-network. You need a PCP, which is a primary care physician, and you'll need a referral to see a specialist. PPOs are on the other end of the spectrum, offering you the most flexibility, usually with the highest monthly premium. You can operate in and out of network, although out of network will be more expensive. You don't need a PCP, and you don't need referrals for a specialist. And then EPOs are somewhere in between. These are much more common on the marketplace than PPOs. Now, there are some big changes coming to the marketplace in 2026, although I'm very eager to see which of these changes will still be accurate by the time this video is published, because the information that we're getting just seems to change on a daily basis. So in 2026, the maximum out-of-pocket maximum for an individual is $10,600, and for families, it's $21,200. There are also some additional changes as part of that one big beautiful bill with regards to gender-affirming care and eligibility for marketplace plans. If you'd like to learn more about that, I will link the video that discusses that at the end of today's video. As far as additional changes, really one of the biggest things that we've been talking about is the expiration of those enhanced premium tax credits or premium subsidies, which were expanded under the Inflation Reduction Act and American Rescue Plan Act. Basically, at the end of 2025, these enhanced premium subsidies are set to expire, which means that many Americans could see their premiums raised by as much as 75%. Now let's switch gears and talk about those 10 essential benefits. So all of the plans offered on the marketplace must offer at least the 10 essential benefits. And many of these benefits are considered preventative, and they're offered at absolutely no charge even prior to meeting the deductible. So the 10 essential benefits would include things like ambulatory patient services, emergency services, hospitalization, maternity and newborn care, mental health and substance use services, prescription drug coverage, rehabilitative and habilitative services and devices, laboratory services, preventative and wellness services, as well as chronic disease management, and pediatric services, which includes oral and vision care. For adults, if you're in the need of dental or vision care, you can actually find those as add-ons in the marketplace as well. However, I just want to let you know that private insurance for dental and vision is usually pretty darn inexpensive, so if you would like some more flexibility, I would highly encourage you to check into private options as well. Now let's talk about the metal tiers. Metal tiers can be confusing because people are often under the false impression that a platinum plan means the best coverage and a bronze plan means the worst coverage, or that platinum offers better benefits than bronze does, and that's simply not the case. It just really has to do with the cost share, the co-insurance or co-pays. Basically, bronze plans will have a 60-40 split, meaning that your insurance carrier will pay a 60% and you'll pay a 40% co-insurance. Silver is 70-30, gold is 80-20, and platinum is 90-10. That doesn't mean that platinum offers better benefits. It really just breaks down to the cost sharing. You will notice when we look at the plans in just a moment that because of the way this cost sharing breaks down, platinum plans tend to have a higher monthly premium than bronze plans. However, there may be extra savings available to be had if you're eligible with a silver plan, and we'll take a look at that as well in just a moment. But before we do, as I mentioned, there has been nonstop news specifically targeting those premium tax credits and the future of the Affordable Care Act. So please, please, please make sure to subscribe to stay up to date. It's more important now than ever before. And of course, if you have questions, you can reach us in the comments below or at the number on the screen. If you'd like assistance in enrolling in your marketplace plan, we are more than happy to help. We're licensed health insurance brokers, we're licensed nationwide, and there's absolutely no charge for our services. So please, yes, do make sure to subscribe to stay up to date, and please make sure to like this video so we can get this information out there. All right, let's take a look at Healthcare.gov. So plans are finally able to be previewed on Healthcare.gov. If you click over here where it says See Plans, it will take you to the See Plans and Prices page. Now this is previewing 2026 plans. However, we won't be able to actually enroll until November 1st. So you will put in your zip code, and then it will ask you several questions about your household. Now, of course, you can skip these steps, but answering these questions is going to determine whether you are eligible for premium tax credits or not. Now, of course, at the recording of this video, we are still in the government shutdown, and who knows if those premium tax credits will in fact be extended when we're referring to the enhanced premium tax credits. So this is how things currently stand. We're going to skip this question. We will put it's us and other people. We will put married, continue, and that we have dependents. We'll put 2 dependents, meaning people that you claim on your tax return. Let's tell us about you. Now it's going to ask if you're eligible for health coverage through a job, Medicare, Medicaid, or CHIP. It asks this to determine your eligibility for a premium tax credit. If you are eligible elsewhere, then you would be ineligible for a premium tax credit most likely. It also asks if you're a legal parent of a child under 19, pregnant for the purposes of Medicaid, tobacco, etc. So we're going to put a legal parent because we did say that we have 2 dependents that we will be claiming. Continue, we will put our spouse, who is also a legal parent, none of the rest of these, continue. And let's put, let's see, we'll mix it up a little. 4-year-old male, who's obviously none of these, continue. And we'll put another 4-year-old male, again, none of these, obviously not pregnant or tobacco user, continue. It will ask you to confirm your household members, just make sure all this information is correct. Confirm, and then we're going to put in our income for 2026. Now, I actually just did this recently with this same income for another video, and the premium tax credit was a little bit different. So let's see. This is our estimated savings. View plans. Oh, I do want to mention, actually, let me go back and show that to you again. You may be eligible for extra savings if you pick a silver plan. This is based on the income and the household size that I put in. So in this case, if this were our income and this were our household size, we would definitely want to put a keen eye towards those silver plans because it will offer us additional cost savings, not only with a monthly premium, but deductibles, copays, and co-insurance. So it could certainly end up being much better for us in the long run. View plans. So currently there are 81 plans available. Currently it is filtering by lowest monthly premium. Now, as I said, I actually did this recently on 2025 plans, and there were several plans with the same income, same household size, that were available for $0 per month. So we can already see that this is an increase. Now, I put in an income that is perhaps on the lower side for a family of 4. So I am still seeing a significant premium tax credit. However, if those enhanced premium tax credits are not extended, then the average individual would see a much larger increase than $50, $78, etc. Okay, so here's all the plans available. As I said, it's currently sorting by lowest premium. You can also sort by lowest deductible because, as I mentioned, low premium plans, great for someone with more average or basic health needs, looking to take advantage of low monthly premiums and have a plan in place should they actually need to utilize their health insurance. Lowest deductible / lowest out-of-pocket maximum, better for people with more extensive medical needs who perhaps are willing to pay a little bit more on a monthly premium because they are going to be utilizing their health insurance more frequently. We'll leave it at its lowest premium for the time being. You can also add filters. Up here, important, your monthly premium. If you know that you have a very strict budget and you can only pay $500 per month for monthly premiums, then you need to put that in. We're deleting for right now. Easy pricing. Oh, this is very, very helpful. So easy pricing plans have the same out-of-pocket costs and care before deductibles for some services. This is great. This is definitely something that you want to look towards. It's unfortunate when you look at some of these plans and you'll see that even a visit to your PCP or a specialist, you have to meet your deductible first, and those deductibles can be thousands of dollars, so that's not really helpful. Now, of course, that doesn't include preventative care, but a trip to the urgent care, you're going to need that over the course of the year. So it's these easy pricing plans are great. You will see some plans have the easy pricing, some of them don't. So I'm seeing bronze, silver, and gold. I don't see any platinum plans available. Not that uncommon. But you could, if you're specifically looking at silver, you would want to click that, but I wouldn't necessarily filter based on bronze, silver, or gold because you just don't know until you're comparing the plans. Maximum yearly deductible, you can filter by that. Health plan types. This is important. EPOs, HMOs, and PPOs. If you are someone who sees a specialist who is going to be out of network, doesn't accept many plans, you need a PPO. If you're someone who travels nationwide and you need access to nationwide coverage, you need a PPO. Don't even bother looking at an HMO because you're going to end up having to pay completely out of pocket to go out of network, and that will end up costing you in the long run. Now, if you're someone who, just maybe needs a little bit more flexibility, you don't want a referral to see a specialist, then an EPO could work as well. But if you are someone who specifically needs out of network coverage, just look at PPOs because an HMO is going to end up costing you so much more in the long run, even though those premiums may be lower on a monthly basis. Insurance companies. This is also something that is very, very important. So if your doctor accepts Aetna and Blue Cross and Blue Shield and United, then filter by that. You want to make sure that you stay in network whenever possible. Medical management programs, we'll look at more of these in just a minute, but if these are things that you need additional, management with, then you're going to go ahead and click that. Health savings accounts. If you are in need of a health savings account because you are a member of the FIRE community looking to retire early, you want to lower your MAGI to maximize those premium tax credits, you're someone who's investing with your HSA, then go ahead and click eligible for HSAs. We will likely see many more HSAs this year than we have in the past, so it may be a little bit easier to find an HSA than perhaps you had found in the past. Also, if you already know your medical providers and prescription drugs, go ahead and put those in as well. You want to make sure that your provider is in network. You want to make sure that your prescription is on your plan's formulary. And you want to be able to compare your prescription drugs costs when comparing plans. There can be a stark difference from one plan to another. So I'm not going to put any of these filters on right now. I just wanted to walk you through exactly how the filters work and what you can filter based upon. So we'll click cancel. All right. So again, here are all of the plans. This is the first plan with the lowest monthly premium based on our tax credit eligibility. So this plan for a family of 4 is $43.50 per month. That is for everyone. That is not your individual rate. That's the family rate. the deductible is $1,400. That's the family total. When we compare these plans more specifically in just a minute, you'll see the individual deductible as well as the family deductible. And the out-of-pocket maximum is $21,200. Again, that's the family out-of-pocket maximum, not individual. We will see that in just a moment. So let's see, does this plan have the easy care? Yeah, it probably does have easy pricing. I'm not seeing it, but if I wanted to filter based on easy pricing, we would see, which plans specifically have it. But I can see here, primary care, $95 visit from day one. Specialist, $175 from day one. Urgent care, $175 from day one. So it's not telling me that I have to meet my deductible before I have any access to care that is non-preventative. Emergency room, things like that, you're pretty much always going to have to meet your deductible first. So we can count that out. But more of our basic care, you would like that to be included prior to meeting the deductible, especially look at this deductible. That would be absurd to expect you to meet that deductible before you can go see a specialist or a PCP. Now, we will see in a moment when we compare this plan to a plan with a higher monthly premium. Look, these are high copays. To go see your PCP, $95, specialist, $175. That's because this premium is so low. They're making up those costs here. So low, you can see already, low premium, high deductible, high out-of-pocket maximum, higher copays and coinsurance, just the way it is. But we are going to compare this one. You can compare up to 3 plans, which we'll see in a moment. So that way you have a better idea of what the spectrum of plans might be. So this is a more bare bones plan. Lower monthly premium, higher costs when we actually utilize the insurance, and you'll see some of those additional benefits in just a moment. Now let's scroll down. Okay, this is another bronze. Another bronze. Oh, that's funny. So this one actually specifically says easy pricing. This one doesn't, but I would consider this to be easy pricing because it's specifically saying from day one, not after you've met your deductible. That's unusual. Maybe it's a glitch. Anyway, let's scroll on down. We're looking at bronze. Let's try to find one of those silver plans with the extra savings. Okay, I am going to filter for that. Okay. Let's look at that. Apply filters. Okay. Much higher monthly premium, lower deductible, lower out-of-pocket maximum, much lower copays. Let's see. Is that the one I want to compare? Let's compare this one. Yeah. Okay, let's compare this one. And then let me see. I'm going to compare one more plan. Let's go to I'm going to remove this filter. I'll look at a gold plan. Apply filters, let's see. $15. Yep, you can already see. Oh, wow. So this is a little bit more per month, but that deductible is much lower. It is a separate drug deductible. It's still a pretty high out-of-pocket maximum, but these are relatively low, your copays and coinsurance. Let's see, $30. All right, well, let's go ahead and compare this one. Compare. And then we go up here, compare 3 plans. You can do up to 3 at a time. See, this is the only one that specifically states easy pricing, but I would consider these to be easy pricing as well. So maybe there's a glitch with that filter. Anyway, so monthly premiums for $43.50, $466, $565. So a pretty broad range here, but we can see the deductible, $7,000, your individual deductible versus $14,000 family, $3,000, $6,000, or $2,200. Let's see, $2,200 individual, family. Wait, oh, your family deductible. Sorry, your family deductible is $3,600. Okay, and there is a separate drug deductible here. Sometimes that is the case. So if this is the case with your plan, basically for all of your medical spending, so visits to the doctors, lab work, etc., the deductible is $1,800. The drug deductible is $400. So this only applies to medical spending. This applies specifically to prescription spending. So even if you had spent $1,800 in medical spending, you would still have to meet your drug deductible before the insurance begins to contribute to the cost share. We'll scroll down and look at that more specifically in just a moment. I also want to talk about the individual deductible versus the family deductible. So if you are on a family plan, if you as an individual have not met, in this case, this $3,000 deductible, but your other family members, let's say, okay, let's talk about mom, dad, and we had the 2 kids. Let's say that mom hasn't spent anything this year. She hasn't been to the doctor at all. But child number 1 has broken a bone and they've spent $2,000 towards their deductible. And child number 2 had to have surgery and they spent $2,000 towards their deductible. And dad had to have some procedures as well and he spent $2,000 towards his deductible. Well, not a single individual met that $3,000 deductible, right? But the family deductible has been met. So each individual on this plan will have been considered to have met their deductible, including mom, who hasn't spent anything. So if you are on a family plan and these same rules apply to the out-of-pocket maximum, if you are on a family plan, it's basically just a little extra way that can help you save money. Same thing with out-of-pocket maximum, except of course with the out-of-pocket maximum, that means that your insurance carrier takes on the remainder of the bills for those covered in-network services for the remainder of the year. So here we have an EPO, an HMO, and another EPO. I didn't select a PPO, unfortunately, but if we were to have selected a PPO, we would see that there was a deductible and an out-of-pocket maximum for in-network and out-of-network services. 2 separate deductibles and out-of-pocket maximums. Bronze plan, silver plan, gold plan. We would also see our medications if I'd put that there. Star rating, sure, you can look up the star rating. This seems to be a newer plan, so it hasn't been rated yet. Plan documents, highly important. Maybe don't get into it at this stage, but once you've sort of narrowed down which plans might be best for you, you definitely want to look at the summary benefits, you want to look at the plan brochure, you want to look at the provider directory, and you absolutely want to look at the covered drugs. I'm going to jump over costs for medical care and discuss prescription drugs for just a moment. Here it's going to break it down. So it's breaking it down into 4 basic tiers: generic, preferred brand, non-preferred brand, and specialty drug. So for this one, generic drugs, $25, $20, $10. For preferred brand, 50% coinsurance after deductible. So they're definitely making up for that very low monthly premium here. You will not have coverage for a preferred brand drug, and sometimes people do have to take a brand name for whatever reason. Usually the generic should work just as well, but sometimes the generic isn't available, or for whatever reason the generic doesn't work for you. I have known people that has been their experience. So if you are such an individual, you would have to meet that $7,000 deductible before your insurance would pay even 50% of the medication. So you can see where they were making it up already. As opposed to this plan, $40, no discussion of deductible. And this plan, $35 copay after deductible. However, this is that plan with the separate drug deductible. So no, you are not having to pay $1,800 out of pocket. You're having to pay $400 out of pocket. So we're already seeing that the silver plan seems to be weighing in our favor with prescriptions. Let's scroll down. In-network 50% coinsurance after deductible, already starting to really stack up there. Non-preferred brand drugs for this one, $80 copay after deductible. Now, unfortunately, that deductible is still significant. It's $3,000, so you would have to spend a significant amount before you would have a copay, but an $80 copay is going to be much less than a 50% coinsurance. Coinsurances can really stack up. If, medications can be $1,000. And for this one, $75 copay after deductible. But again, that deductible is only $400. Specialty drugs, 50% coinsurance after deductible, $350 copay after deductible, 50% coinsurance after deductible. So this might be your best bet depending upon the actual cost of the medication. If it's a less expensive medication, then 50% coinsurance, because we have that lower deductible, might be better suited for you. So this is why we say that there is no real one-size-fits-all solution to healthcare, because if you were just looking at the monthly premiums, you would say, there's no way that I would pay this. How are these plans even comparable? However, if you are someone who takes prescription drugs regularly, this separate drug deductible is the fact that it has a separate drug deductible that is $400 as opposed to having to meet a $3,000 deductible or a $7,000 deductible and then pay those high coinsurances. This plan would likely save you money. All right, I'm going to go back up to costs for medical care. So let's take a look here. Deductibles, we've already discussed these. Out-of-pocket maximums, we've discussed these. PCP, so in-network $95 visit from day one. No out-of-network coverage because we're talking about EPOs and HMOs. Limits includes $0 for the first 3 visits. Very nice, $0 for the first 3 visits. So there is a little bit of flexibility there, basically. So it's $95, but you have 3 visits without having to pay. So that is a little bit more reasonable. $40 visit from day one, also pretty reasonable. Specialist, $175, $80, $40, more reasonable. Preventative care, as I said, these will be covered at no cost to you. X-rays and diagnostics, so 50% coinsurance after meeting your deductible. That's going to be significant because it is a high deductible. 40% coinsurance after meeting deductible, a little bit less because the deductible is lower. 30% coinsurance after meeting deductible, certainly the most reasonable because that deductible was the lowest, and 30% when we're talking about services that can be rather expensive is going to be much less expensive than 50%. Lab work, same deal. Outpatient, very similar. Let's see, hearing aids. You should also know that hearing aids are now available over the counter in most drugstores. Eye exams, eyeglasses for children, health savings account, because it's a bronze plan, so we have a health savings account eligibility. Let's see, generic, we already talked about medications. Access to doctors and hospitals. None of these are PPOs, so we're going to see no across the board. And you need a referral to see a specialist. No. Urgent care and hospital services. It'll break down these costs more. Urgent care, $175. Out-of-network, $175. Oh, it'll let you go out-of-network for this one. Interesting. In-network, $60. No out-of-network. In-network, $40. Out-of-network, $40 as well. Emergency room care. In-network, $50. So even though these plans are HMOs and PPOs, in the case of a true medical emergency, please head to the nearest emergency room. Don't be looking up what's in-network and out-of-network. You will still have access to the same rate regardless if it is a true medical emergency. Inpatient hospital stay. Okay. Cost coverage and examples, it's always the same. It's a healthy pregnancy, managing type 2 diabetes, and a simple fracture. So you can see what these costs would be. And as expected, this plan is the most expensive, lowest premium, highest cost of care. Dental coverage, medical management programs, that's what I had mentioned earlier, if you wanted to filter based on that, if that's very important to you. Now, you can see some plans and details may change when you fill out an application. Very important to keep a keen eye. Don't just take this at its word. Always, take everything with a grain of salt. Make sure that all the information that you're seeing here is completely 100% accurate. And you can usually find more accurate information in the summary of benefits, plan brochure, provider directory, list of covered drugs, etc. So these are some of the most important things that you need to look at when you are comparing plans. Let's go back to plans really quickly. I do want to see, let me see if I can find some of these plans that don't have, I did want to explain that to you. I'm going to look at a bronze plan because that's more likely. Okay. I did want to show you this as well. Let's see if I can find this. And who knows, maybe I can't. $40. Yeah, this is funny. So when I looked the other day, I was seeing more plans that basically didn't have care from day one. It was showing that you had to meet your deductible first. So perhaps these plans that I'm looking at now, that's no longer applicable in this area. But again, do take that into consideration. I'm hard pressed to imagine a scenario wherein you would save such a significant amount on your monthly premium that you wouldn't want to have access to basically any care until you've met your deductible.
yeah, I mean, we did see, you have access to 3 visits and telehealth, but please look at those details very carefully. You don't want to enroll in a plan just because it has a cheap monthly premium and then find out, well, great, I only have to pay $25 per month, but I basically can't do anything unless I spent $14,000 out of pocket. So those are some of the more important things to look at when comparing plans. And of course, you would also see, if we wanted to look at that as well, you could add on dental and vision since your plan likely won't cover it for adults. That being said, dental and vision are also readily available off the marketplace via private plans, and they're usually very inexpensive and will offer you much more flexibility.
So as of right now, the open enrollment period will be from November 1st to January 15th in most states. Of course, that is changing in the future. So please make sure to reach out with any questions or concerns that you may have in the comments below or at the number on the screen. As I mentioned, we are licensed health insurance brokers. We're licensed nationwide, and there's absolutely no charge for our services. And make sure you subscribe to stay up to date with all these changes that are coming out of Washington, and make sure to like this video so we can get this information out there. As always, thank you so much for watching and have a wonderful day. Bye-bye.